There's still a big use for OTC medicines and a lot of things. I mean, between just plain old acetaminophen and anti-inflammatories for arthritis and different types of pain, they're good. We found that some of them that we use to treat symptoms, like cold medicines, are not good for like kids under 5. They're not recommended, not good. For everybody else, the evidence is oftentimes marginal at best, although they do seem to relieve symptoms, and some people more than others. But I usually tell patients if they help, fine, use them as recommended. But if they don't, they're not going to make you get better faster. They're just going to relieve your symptoms. So use them if they help. They're not for long-term use, just short-term. As far as supplements and those sort of things, that's a really hard one to pin down because they're not very well regulated by the FDA. So different brands or types of a supplement are going to vary a lot, and there are very few controlled studies on a lot of them too. I'm not saying that there isn't benefit from some of them, but as far as good hard evidence of benefit and reliability and consistency in dosing and in formulations is lacking. And so some of it's buyer beware, but there is some good to be derived from some of them. Well, I try to get information first to find out that it's not going to do any harm, and most of them won't. I mean, that's what they do. I mean, they don't do any harm. They may not do any good, but they don't do any harm, so they're pretty free with handing it out. So I do that first, make sure that's not going to interact with what they're taking already and that there's no harm to be done. And if that is okay, then I usually let them try it. And if they feel it's beneficial and it's doing no harm, then why not? I mean, it's hard to argue with what works. And I think it's a matter of amount and duration of use. You have things like decongestant nasal sprays that people can become dependent on if they use it for more than a few days. We all know that too much Tylenol or acetaminophen can trash your liver and kill you. And some people use those too freely, so you have to caution them. Anti-inflammatories like ibuprofen can cause an ulcer if you overuse them or don't use them properly. So there aren't really very many that I totally discourage. I just caution their use. There's some out there that I don't feel have much benefit, and I usually share that with patients, but it's still up to them. I advise them. I'm an advisor. That's my role.